Welcome to the podcast series, Rooted in Wellness, sponsored by the Effie Berry Training Institute. The Effie Berry Training Institute is funded wholly or in part by the government of the District of Columbia, PC Health, HIV/AIDS, Hepatitis, STD, and TB Administration, or as we like to say, HOSTA. Rooted in Wellness is a podcast miniseries dedicated to exploring holistic approaches to health and well-being. Join us as we delve into topics such as trauma, HIV, mental wellness, and the social determinants of health, all with the goal of helping you cultivate a balanced and thriving life. We invite you to listen to our other episodes, Trauma at the Root of Health Outcome Disparities and Roots of Resilience, HIV, Prevention, Management Strategies for Black Women, already available for you. Today's episode, HIV Prevention for Queer Communities of Color. We'll delve into the unique experiences of Black, queer, and other communities of color in the context of HIV prevention, emphasizing the complex intersections of societal norms, cultural boundaries, and identity. So I want to introduce you to our speakers for today. We have Kaniya Walker. Kaniya went to Norfolk State University majoring in psychology, but her passion is working with marginalized groups of people, LGBTQIA plus communities, people living with HIV/AIDS, women of color, and individuals experiencing homelessness. Kaniya has been featured in articles with the American Civil Liberties Union on the decriminalization of sex work, as well as Insider, Washington Blade, and many more targeting the struggles of trans women of color. Brandon Harrison is the current Associate Director of Capacity Building Assistance here at Health HIV and a seasoned expert in health equity, harm reduction, and HIV prevention. With over 15 years of professional experience, Brandon has dedicated his career to supporting communities most impacted by health disparities, particularly queer communities of color. His work focuses on creating inclusive spaces, empowering organizations through tailored capacity building efforts, and advancing equitable access to healthcare. Thank you for joining us today, both of you.
No
So,
problem.
let's
Hey,
jump right into the conversation. I'm going to start us off just with like a good question to kind of round us out and get us going. How do cultural and family expectations affect HIV prevention for queer people of color?
I can go first. Well, I think when you think about cultural, the first I think about in the with people of color is religion. So religion plays a big part. So when I feel like that a lot of times when queer people have grew up in religious households, that plays a part. And so also I think a lot of times stigma because I know that I've heard a lot that when someone first tells their parents that they're within the community, whether they're gay, queer, trans, however, the first thing they think about is HIV. So I think it's a big stigma around. I think that we're still, and I mean, I still see it today, like it's still a big stigma around that HIV is only for gay people. So I think that that is some of the expectation that I see that comes from queer people of color and their families.
yeah, I
Absolutely.
100.
Mhm.
I was gonna
No,
say
go
I
ahead.
absolutely have to agree that culture and family are both rooted in stigma, traditions, values, and it definitely plays a role in how queer people, are able to express themselves, how we're able to seek services, talk about the services that we need. And so, sort of to make any sort of progress, we have to address these barriers, and break down the walls of stigma, as well as, some of those religious beliefs that our families hold.
Absolutely. And it's super important to normalize these conversations and have these conversations not only with our elders, but with our youth that are, deep in kind of like faith-based like upbringing. It's kind of very difficult to kind of to bridge that gap, which kind of leads me to my next question. what can community groups do to help queer people of color access HIV prevention resources, education more easily?
Want me to go first, can I?
Yeah, I mean, I can go first. Well, I feel like that. I think that when it comes to community groups, I think a lot of times with community groups, I think that they also have to think about the stigma that they instill too, because, like originally from Virginia Beach. So, for an example, like you have, like now they have, like I remember, like when I first came out in this lifestyle or whatever, we had one organization like for the whole like Hampton Roads area, and it was called TAC. So it was called Tidewater AIDS Crisis. So of course, like any this is AIDS, not even HIV. So no one wanted to go there, and I think that people that work there were, because Hampton Roads is such a small area, and people who go there, I felt like that a lot of times people would go in there and test positive, then like everybody would know. And so even fast forward to now, they have more organizations. That organization is no longer open, but they do have organizations there that are trustworthy. But the things that happened at the original organization, has kind of leaked over. So I think that as far as an example like that, I think community groups also have to build more trust within community, because sometimes like people are coming to an organization, they may see somebody that they know and they automatically turn around. So I think that's something that needs to be done, is like building more trust, making people feel safer, because we can say that it's a safe space, but how are you showing that it's a safe space?
Mm-hmm. Absolutely. Brandon?
Sure. I mean, I also think that, the community groups can make more affirming places, more inclusive, affirming places. I think um, if they find ways to sort of reduce stigma by creating like safe spaces that celebrate queer identity. So I think going back to what Kanai said in the first answer is that usually when families or people think about queer people, they think about the disease, they think about all of the negative things that are related to that they've seen, the stereotypes. And so, flipping that over and making it sort of a space to celebrate queer identities, and then bringing in culture and faith into those places and kind of merging it together to sort of meet at that intersection. I think, we can use so community groups can use social media, can partner with political advocates. We know that, coming up, there's gonna be an attack on queer people. We're already seeing it. And so, finding those newly elected officials to partner with and have them sort of support legislation, support groups to make sure that we continue to get funding to provide access. Um, and then I think the other thing about, HIV prevention is, it's we with the advances in PrEP and the way that we can prevent ourselves, if we use those sort of things as empowerment and highlight the equity in it or build towards equity, then, it kind of opens the door for communities to, be more involved, get more engaged, and not feel as stigmatized.
And also, I want to add another thing. And then we think of community groups or community-based organizations. I think that um, we all need to learn how to work together. And I think that because, I look at it like like my organization may not be able to do something as well as another organization. So I think that sometimes that causes a gap in between people, receiving services and resources, because, it's kind of like everyone's fighting for the same pot of money. So, versus of looking at it like it's a competition, maybe try working together so we can have more spaces where everyone, because I would want my customers to be able to go to another organization for something that I can't offer. I want them to be able to go over there to feel comfortable and feel like it's a safe space so they can actually get what they need. So I also feel like that we all need to come together and work together. And especially like with what's going on now in the next 4 years, it's going to have to be a thing where we all going to have to work together and all be one community group, not separate community groups.
Hmm. Absolutely. I think something too that a lot of people don't focus on enough is that though we use terms like, queer and LGBTQ plus, communities, within these communities are a lot of nuances. As a gay Black man, you're going to have different issues than a trans, Black woman, than a lesbian person, than a person that, identifies as asexual. There's going to be a lot of different outreach techniques, and one size is not going to fit all with a lot of these community organizations. So outreach needs to change, and that's something that I think a lot of organizations don't necessarily like to hear, because I think tabling at pride is kind of like sometimes the extent of what some of the communities think and feel as outreach. But if we're really going to meet people where they are, we really need to understand the nuances of each and every community kind of under that LGBTQ, plus umbrella. And that can make things a little bit more complicated, right? Um, when we talk about sex work, right, within the community, when we talk about gay clubs, gay spaces, lesbian spaces, things of that nature, they're each going to have a very different type of outreach when it comes to HIV prevention. What do you think organizations, community members can do to really meet people where they are as far as it is concerned with HIV prevention, given all the nuances within these communities?
One thing that comes to mind, obviously, we know the power of social media. And so I think organizations really, really have to find, especially if we're going to reach youth, if we're going to reach, I mean, any population, I think all populations are sort of that, are using some form of social media, whatever that looks like for them. So I think beefing up and being, very, very current with our social media messages, how we're using them, the platforms, using ads, taking advantage of all the perks that social media has, um, is one way to reach these populations, and making sure that the messages are relevant, and culturally responsive for each group. And so not using one message for that we'll use for someone 65 and plus that we're going to use for a 30-year-old sex worker, right? So just being mindful of that. I think really, really the other thing that we're going to have to do is recognizing that, with sex comes pleasure, and, not being shameful about pleasure. I think that we have uh, the media, everything is taken away the pleasure about, life and sex and things like that. And so we have to make sure that we are, you know, bringing pleasure back to the table, and that we're removing our own biases, our own stigma, when we think and craft messages that are going to reach these audiences.
And I want to piggyback off something that you said earlier, Leo, about figuring out like the different nuances between different communities, because this is something that I have struggled with a lot at my own job, because I feel like that. So I do have a lot of events and things like that for, trans identified individuals of color. So a lot of times my job will come to me and be like, can we offer testing there? And I'm like, no, I don't want to offer testing there, because especially when you have trans women of color, majority of them are not going to come to an event to be tested, because if you think about it, it's like if they're on hormones already, they're already taking care of that. Some of them are already positive and they know their statuses. So that goes to say, and that's not just with that's with any community. I feel like that. Yes, we know that HIV testing is very important, but I think we get so lost in HIV testing because you're trying to meet these deliverables. So even when
Hmm.
you're out doing outreach, you're just focusing on HIV testing to get numbers and deliverables, but you're not focusing on that whole person, trying to find out, what this person really needs. Or even, sometimes I see a lot of like when it comes to harm reduction as well too. You can go out and pass out Narcan strips or pass out fentanyl strips, but are you actually really educating these people on those things, or like are you in the right environments to even pass these things out? I also feel like something else that I'm really big against is like having like doing HIV testing at nightclubs, doing HIV, like that is something that I'm so against. I like doing it, HIV testing at big events because, you know, if someone is going to have fun, why would you want to give someone bad news? And on top of that, who would even want to get tested?
Hmm.
And they're trying to, you know, they're already drunk or, you know, maybe high or whatever their choice is. So I think we do have to be mindful of the type of outreach that we're doing. We have to get away from just basically HIV testing because HIV testing is kind of getting played out because that's you doing HIV testing, giving a gift card and you're not being able to figure out what people really need because if someone sees a gift card, of course, who's not going to get tested for a gift card? They're going to get their gift card, they're going to keep it moving versus you trying to have a conversation with them to find out what do they need as a whole person.
Absolutely. Absolutely. I think, and it's kind of like what I was saying before, there's nuances within the community, and we need to get much more creative in how we do our outreach. We need to get much more creative in how to link people to wrap around services, not just kind of pushing one, thing in their face. There needs to be more creativity around education. I myself, when I was client facing, there was a lot of tabling outside of clubs and, free admission to get in if you get tested and things like that. And it really does put the community in this place of like, oh, you think this is all we're kind of good for? Is that like I'm gonna come get tested just so I can get into this club? And we did, we tested a good amount of people, but I would love to know, how many of those people circled back and really were concerned about their health in that moment, right? And that was definitely like a difficult thing to kind of like connect. So we definitely need to be a lot more creative in our outreach efforts as a whole. And speaking of outreach efforts, I always like to kind of take it back to self autonomy, body autonomy, and I'll ask this question: how can doctors and health programs be more respectful and more effective when working with queer communities of color? How can they really show up for us?
I mean, I can go first.
Okay.
I think that for me, and I was just talking about this. The main thing with doctors, I feel like that because I mean, even the doctor at my own job, like I mean, he's coming around now. But I think when you have doctors, we know that we have a lot of doctors are like older doctors, right? And so, I mean, we're seeing younger doctors now, but you know, I feel like that doctors are so stuck in their ways that they feel like they don't need trainings. And I think that doctors need to be trained more. So I feel like, yes, I may be like a linkage to care coordinator. A doctor should be sitting in the same training that I'm sitting in. And I think that a lot of times, you know, like when you have, especially even when it comes to primary care doctors, they need to be in the kind of trainings that we're in because I hear so many stories about doctors, like, especially when it comes to like Black women in prep. And it
Mhm.
irritates my soul because I've had a client that came in not too long ago and she asked her doctor, so just like a short story, like I had a client come in my office. Her and her best friend would come in the office and get tested all the time. Her best friend was a Black gay man. She was a cisgender heterosexual woman. And they would come all the time. And it happened one time they came, her best friend found out he was positive. Then he became a client. So, you know, by her coming to get tested with him all the time, that kind of sparked her mind around PrEP. And so when she went to her primary care doctor, he told her that she did not need it because she was not a gay man. And so that's why I think that it's very important for doctors to like be in some of these same trainings that we're in because I feel like it's 2024, we're going to do 2025. And we know that everything changes every day. Everything changes so rapidly. So that's how I feel about when it comes to doctors. Like, I'm very passionate when it comes to doctors and trainings because they are so stuck in their ways. And if you're not going to, and also another thing is that if you're not going to people, if you're not going to an infectious disease doctor, a lot of times you don't even have type questions, I mean, conversations around sexual health. Like you're just going in there, so it's not like you said earlier, like wraparound services. So, so I think that that's why doctors all should be made to go to different trainings, like around sexual health, talking about sexual health, being open to sexual health, because some doctors don't even feel comfortable talking about sex with their patients.
I agree that providers do need to, you know, be held to the same, culture responsive care trainings as other frontline staff as well. I think, we when we think about you reference Black women and PrEP, but when we think about systemic racism and the barriers that that creates for care in general. So whether it's about pain or maternal health or HIV prevention, we know that all of these things are tied to systemic racism. We have decades of examples where folks in the Black people of color, queer people have been sort of excluded for these from these opportunities. We can look at when PrEP first came out, Black men versus white men. The numbers are still the same now. Not the same where they're getting better, but we know that those disparities exist. And so I think providers can, make some sort of foster some inclusive, stigma-free environments. I think, and that begins at the door. So the providers in there need to be making sure that security and front desk people are also, culture responsive. um they need to also understand how, like, we started the conversation with culture and family, but culture and religious beliefs play a role in how we access care. And so some folks may not want a pill because they have their grandmother didn't use a pill or things like that. So I think providers have to be aware of those things. um and I'm going to go back because I'm on a pleasure tour, to the comment about pleasure is that, providers have to adopt, some sort of pleasure positive, sex positive approach that, celebrates a person's agency to make choices about their bodies. And I think when you reach that level of taking a sexual health history and having a real conversation and acknowledging pleasure exists, then the recipient can trust the program better. They can, they may engage, they may refer friends, you may, get other patients to come in. And this can absolutely improve community health outcomes, improve individual health outcomes, and improve, the way that we engage in whatever prevention efforts that we are deciding to seek or care efforts that we're providing or that we're getting from this provider.
No, absolutely. Absolutely. Thank you both. Those were really strong comments. And it also kind of leads me to what I was talking about before, as far as being creative with our outreach efforts. I think providers in general need to be much more creative with how they're seeing each and every client, with how they are bringing up PrEP and PEP and just all of that. They need to really get to know their clients on, a sexual level so that they are able to provide to that client options that are going to align with, their outside activities, in a responsible manner. And I think once we normalize those conversations in doctors' offices and clinics, more people will feel empowered to get on Doxy, get on PrEP, get on PEP, all of that, or just ask simple questions about their bodies and their sexual health. Because I still have adult friends that giggle, when I say, vagina or penis, right? And it's crazy because I'm like, you're 45, like what's going on? You're still giggling at that? So I think it's definitely something that continues to be um, made to be more creative and normalized in those spaces. And speaking of which, I wanted to ask you both about this topic that actually came up recently at a conference that I was at. The whole You Equals You, campaign, has been going on for quite some time now. It is definitely a catchy slogan that, people in the LGBT community, it's kind of been, shoved down their throats. We can remember it now, verbatim. But at this conference that I was at, um, the You Equals You slogan was brought up as also kind of being a bit problematic. Because not everybody within the LGBT community has that full access to, PrEP. Um, or has that full access to antiretroviral drugs for a number of reasons, social determinants of health. But we won't jump down that rabbit hole. So I wanted to ask you both, what do you think of the U equals U kind of like campaign and slogan? And do you think that, we need to adapt maybe something a little bit more accessible for those that might not have full access to, that line of drugs that would make them undetectable?
First.
You want me to go first? I was just saying. Um, yes, I mean, I think you equals you has, sort of great potential. I mean, we've seen what it does. It's changed a lot of the messaging. I think that it has done some stigma reduction. I love how, the dating apps and things have incorporated it, provided information. I think that all of those things are great, and I think that it still has, the potential to be a game changer in reducing, stigma and reducing the way that we interact with each other. Um, you know, I really, for people that have systemic barriers already to care, it may open the door, but we know that, if we're still not addressing the stigma and the racism in healthcare settings, that it may cause more harm, right? So people may get to a place and they're like, all they see is you equals you messaging, and they've never been able to achieve an undetectable viral load because of several circumstances. And so that could push someone further away from engaging in care. And so I think that we have to be mindful and realistic with the way that we talk about it. And, making sure that it's more than just using the slogan, that it's sort of a commitment to health equity, and making sure that, as I said before, the places where patients are going are providing affirming, care. They're looking at this whole person. They're looking at, because we know that like healthcare is housing, healthcare is a job, healthcare is food, healthcare is all of these things. And so if you're just giving me a pill, but I have nowhere to store this pill, like I may not ever achieve, an undetectable viral load. And so I think really chipping away at stigma and really addressing social determinants of health is going to be important as we continue to talk about you, which means that there needs to be more funding to make sure that the wraparound things that a person needs can, there needs to be more funding so that a person can achieve you and address their social determinants of health.
Yes, I agree with everything that you say, and I also feel like I think both of y'all kind of mentioned this too. When it comes to like, a lot of times you see equals you, undetectable equals untransmittable. But it's like I think like more funding should be put in it. Also, it should be advertised more because there's so many people who never even heard of U equals U. Like so many people still, and especially when it comes to like the heterosexual community, even like in the LGBTQ community, I have friends that I'm still teaching what is U equals U. But I think that, and like both of you said, I think that when you present U equals U to someone, then you should have things to back it up as well too, like those different barriers, like you all talked about or whatever. And I 100% agree with because it's something else that I always talk about all the time when it comes to like it's the same thing with HIV testing, shoving HIV testing down someone's throat. Also shoving down someone's throat that okay, you need to get virally suppressed or you need to take your medication. But like you stated, it's like the first thing, majority of the time, that needs to be addressed if someone isn't taking their medication is probably like, where they're being housed. Do they have housing? And so I really like the fact also that I like the fact that, they have the injectables out now. I think that that has a lot of potential to helping too. But I think, like you said, that there's so many other things like, housing, food, because if a person is hungry, the person doesn't have anywhere to live at, no one's going to pay attention to a message that says you equals you. So I think that when you're presenting that, you need to have things to back it up as well, like whether it's some type of funding or resources, like, look, we can help you do this, and then if we can help you get housed, we can help you get food, and then you get all these things, then present you equals you. It tells like a whole story basically.
And
No,
just
absolutely.
to Oh, sorry. I didn't
No,
mean to
go
jump
ahead.
in. But I mean something that can I say about, injectables. I think that like when we are thinking about you as you and when we're thinking about priority populations and things like that. I think that providers that utilize injectable prep or injectable prep as well as injectable treatment should, you should really prioritize. And I think all providers should be rolling it out, especially with their patient population that has not been adherent to medication in the past, as a effective way to, sort of help that person achieve you because you, but sorry, I didn't mean to cut you off yet.
No, you're totally fine. And I mean, it all goes back to access, which I think is like this overall umbrella. Like, if we can't get to it because of insurance, money, distance, whatever have you, the ideals of prevention, U equals U, all of that can just be very, very difficult. But definitely, like, thank you both for your comments on that. And so to kind of tie this up with a bow, I'm going to ask kind of one final question that I'm interested to hear both of your takes on. What are some ways queer people of color can advocate for their health and HIV prevention needs? This is definitely something that I think about often as, the political climate changes, as the internet, becomes a place where ideas get shared, and uprisings start, like, what can queer people in the community do to really continue to support and advocate for themselves?
I can go first. I think first we have to own our health, and make sure that we are getting the health care that we deserve. I think there needs to be more education for patients, for queer people, how to advocate for the health care that they deserve. We go into the doctor's office, we see them as the professional, we think that they have our best interest at heart. And there's times that, it's not the case. And so and when that happens, it's okay to fire that doctor. It's okay to go to a different clinic. It's okay to write that Yelp or that Google review to make sure that other people don't experience the same thing. And then, sort of building community, joining support groups, trying to find networking with people to see which providers in the area are giving good care, and, help people share those experiences. Um, yeah, those are two things that sort of come to mind initially.
And for me, I feel like I even tell customers all the time, like, a lot of times when you think about when you go to a doctor, a lot of times, and I have looked at my eye schedules at my own office, and you see these 30-minute increments. And I think that sometimes, and I want people to know that just because a doctor is giving you 30 minutes, you can take more than 30 minutes. Like, if you feel like you're being rushed, say, hey, I'm not finished yet. I also like to tell people, don't be afraid to change doctors. Like, I mean, I watched my sister go from having Caucasian doctors to going to have all black doctors. Like, she didn't mind dentists, therapists, everything. And then also, I feel like that if you feel like that when you go to the doctor and you may feel like a little nervous to ask them something, you can always make a list before you go to the doctor. You can make a list. These are the questions that you have. You can give the list to the doctor and have them go down that list and, answer your questions. But I think the main thing is never be afraid to, switch doctors. That's the main thing. If it isn't working for you, then it's okay to switch doctors. Just like you might switch partners or friends or any of that. Like, switch.
Absolutely. I think too, like something to keep in mind, um, is bring a friend, right? Like people get very anxious. What is it, like white coat syndrome, right? They get in that
Mhm.
office and all the questions that they had outside disappear. And all of a sudden they're like just, a yes person in the office. They're like, okay, okay. Um, I always say like bring someone that's gonna help you advocate, whether that's a parent, a boyfriend, a girlfriend, best friend, like whatever, someone that is not going to let you forget to ask those questions that you need to ask. Um,
Mhm.
I always say ask for things in writing. So if there has been information that you've been given or a diagnosis that you don't understand or anything, just, hey, can I get that in writing? it'll be easy for me to unpack it once I get home and, look at it. Um, I just think there are a lot of creative ways that we can advocate for ourselves that are easily accessible because everybody isn't, a super fighter or super aggressive with their words or, loves to be at the front line of change. But I think making those little adjustments to what might just be a dentist appointment, doctor's appointment, whatever, can really um, help you advocate for yourself. Um,
Mhm.
as we close, is there anything that you two would like to state as far as our queer community and HIV prevention? Any closing thoughts?
For me, I always like to tell people all the time, like, living with HIV doesn't mean dying with AIDS. That's something I always like to say. And I feel like that, you have so many people around you that we see every day that has been living and thriving with HIV for so long. So let that motivate you. Like, let that motivate you to know that life can and will go on if you take care of yourself.
Yes,
Um, I think the only thing I'd add is just, make sure that we are not only advocating for ourselves, but we're advocating for those that may not have a voice. And so being mindful of when we are in these spaces, when our family is treating us away, that's a reflective of how they may be treating people in our community. When the providers are treating us away, that's a reflection of how they may be treating our younger brothers and sisters. And so being mindful of that and using our voice to make sure that we are at least acknowledging and addressing the things that we can address in our own ways so that other people don't have to experience this. Because us running away, us changing doctors and not addressing why we changed that doctor or not letting the community know that this provider isn't, a good provider may end up as a diagnosis for someone else. And so just being mindful of that and putting those things in perspective.
absolutely. Like sharing your experiences is so important. Um, Not only for our kind of own empowerment, but for the community. Um, Thank you both so much for sharing your expertise and your knowledge on this topic. And thank you for tuning in to this episode of our podcast. We hope you found this conversation engaging and informative. If you enjoyed today's episode, we invite you to listen to our other episodes, Trauma at the Root of Health Outcome Disparities, which delves into the profound impact that trauma has on health outcomes across diverse populations, and Roots of Resilience, HIV prevention and management strategies for Black women, which focuses on the empowerment of Black women concerning effective HIV prevention and management strategies. Remember to subscribe, rate, and review our podcast to help us each and reach more listeners. Until next time, thank you both.
Thank you.
Thank you.